Not so long ago, a firefighter's job was about one thing: responding to emergencies. When a building was on fire, they put it out. When someone needed cutting from their car, they responded. We were rightly proud of our emergency response, but not much thought was given to stopping these terrible things from happening in the first place. Our vision is to make Staffordshire the safest place to be. To achieve this, the service is committed wholeheartedly to the principle that prevention is better than cure. Each year we carry out 30,000 home fire risk checks across the county. These visits primarily focus on educating people on fire safety in their home. Our prevention work is having a huge impact. Last year saw the lowest number of accidental home fire deaths and injuries on record. This early intervention and long-term prevention is now rapidly evolving to encompass wider health issues. The reason for this is simple. The most at risk from fire are also often at risk from a range of health-related issues. In Staffordshire, the average age of a person at risk from dying in a fire since 2006 is 70. Working together in this way has already been proven. Nationally, the fire service has been recognised for the significant contribution made to the broader health agenda. This is nothing new for us though. We already know it's the right thing to do. From this partnership approach, we have developed Safe and Well. Safe and Well visits are an extension of the home fire risk checks already being carried out by the service. By focusing on health risks as well as just fire and getting support from other agencies where necessary, we can have a much bigger impact. By using our brand, people and willingness to support the wider health agenda, the service ran a pilot in winter 2015 to support residents and reduce risk and demand. Along with other partner agencies and the Staffordshire Health and Wellbeing Board, the pilot's purpose was to work with Age UK to identify at-risk older people and then provide support to resolve these. At the same time, the service, together with Gloucestershire and Greater Manchester Fire and Rescue Services, were also involved in a nationally supported Public Health England pilot, which looked at 4 specific winter pressures: falls, flu, warmth and isolation. In total, the pilot saw 6,000 properties visited, with 2,600 of those in Staffordshire alone. 90% of those visits were delivered to a targeted audience, those over 65 or with a long-term illness or disability. An independent company was commissioned to evaluate the outcomes of the pilot. It found that each Safe and Well visit cost on average £13. Therefore, 1,000 visits carried out is the same cost as 3 mid to high level falls for the health and social care system. Along with this, 596 referrals were also made to partners during this time frame for further support and guidance. The service is in the unique and privileged position that firefighters are allowed over the threshold to support residents that other agencies may struggle to reach. Safe and Well visits present a real opportunity to make positive changes to people's health, well-being and safety from fire by reducing risk and making interventions during the initial visit, or pulling in support from other agencies as necessary. A person-centred, integrated approach to providing services is fundamental to delivering high-quality care to people who may be vulnerable to the risks of fire. There is no doubt that these partnership projects are making a positive difference to people's lives and easing pressures on health and social care services. So, we're embarking on Safe and Well visits across Staffordshire. As part of this work, we are continually working with our partners to ensure our collective services are fit for purpose and meet the needs of our communities. And by doing this, we are keeping our communities safe and well.